Now, the Democratic Alliance in Gauteng says the public health sector in the province is in crisis. The party says nearly 3 decades into democracy, the South African government is still failing to deliver on some of the most basic democratic rights, and it's in denial about how bad things really are. Heidi Giokos has been looking into some of the issues raised, and she joins us in studio now. Hello, Heidi. So we know that our healthcare system is under strain. We know that COVID highlighted some of the real problems. We also know that in Gauteng we've had a devastating fire at Charlotte Maxeke Hospital, and that a lot of people flood into this province. What exactly is the DA in the province saying is particularly bad?
So the DA in this province, Sally, says that the issue is there's a huge crisis in the healthcare system, and this is not being acknowledged by the powers that be. This is not being acknowledged by those within the healthcare system. And what we do understand is that there have been a number of issues in a number of hospitals. Even if you go back to what happened with Life Esidimeni, it has to, of course, reach crisis mode before there seems to be any kind of intervention. With Charlotte Maxeke, you had that fire that gutted key departments within that hospital, and now this is causing further strain on other nearby hospitals. So the problem just seems to be getting worse and worse. And what the DA is saying in this province is that it seems as though there's no acknowledgement that there's actually a crisis. It just seems as though the officials in this province only say, yes, there is a problem, but we are dealing with it. What we also understand is that there is a massive problem at Helen Joseph Hospital as well as Rahima Musa. What we've been told by the DA's Jack Bloom is that people within Helen Joseph are basically overcrowded in the actual corridors of the hospital. There is no space in the wards, so they are being treated in the corridors of the hospital, and if they are lucky, they basically get moved to a ward. If not, some people are actually passing away in the corridors. So this is a massive problem. We saw that video about a month or two ago at Rahima Musa Hospital, where pregnant women were on the floor and were basically being told there's no space, there's no beds, we are going to have to help you here if we can help you at all. So it just seems as though the problem is getting worse and worse, and what the DA is saying is that there needs to be acknowledgement that this is actually a crisis, and this is something that is a crisis and not something that they're just working on. Let's listen to what the DA had to say about that.
We all know it's a crisis, but the department refuses to describe it as a crisis. First of all, I think you need to know the extent of the problem. We're here at Charlotte Maxeke Johannesburg Hospital. There's a massive parking problem just to start off with. They're short of staff and equipment. The hospital still isn't fully reopened. And at hospitals like Helen Joseph, it's just terrible. I mean, people are crammed into corridors. It takes them days before they get into a ward. Doctors and nurses are at breaking point, and yet, the powers that be won't describe it as a crisis, and there's still corruption and wastage of money, and nothing seems to come together. It's just too terrible for words.
You also approached the Gauteng Premier's office for a response to what the DA is saying. Let's take a listen.
Level best, and I think it must be put into a context. If you look about Gauteng, it actually over a period of 5 years attracts about 1 million people, and obviously those people come in looking for medication. And if you look at people from outside the country who are coming to South Africa, 50% of them come to Gauteng basically. So it gives you an indication of the stretch of the health system, but I can tell you that the guys at Health are trying their level best. But part of the things that we have then started to make it as a strategy is to decentralize health. Give more powers to the hospitals and make sure that actually people who go to hospitals are going for referrals. Because if you do have headache, go to the clinic so that you don't basically clog up the system in the hospitals. But I'm saying if you put it in a whole broader context, Gauteng is the fastest growing province in terms of the population wise. So the health system is bound to have a bit of a pressure.
All right, so the Premier's office just stressing the point of how many people flood into the province, and they're looking at a decentralised health model. But also Gauteng has this 3 billion rand plan. Tell us more about that, Heidi.
Yes, so what we do know, actually just minutes after we did the interview with the Premier's office, a statement was dropped to say that 3 billion rand has been allocated to refurbish hospitals in the province. They are prioritising 15 hospitals in the province to refurbish them. What they do acknowledge as well, Sally, and I think it's important to highlight, is that they've understood and heard the scrutiny of the public, because many hospitals in this province they are in a very bad condition. They have not been maintained for years. They're under-resourced. They don't have what they need to have, and of course this is something that Gauteng needs to address and needs to sort out. But I think there's a lot of concern that will this 3 billion rand be used effectively and will not be mismanaged, and this is where the concern comes in, because we've seen billions of rands being spent on many different things in our healthcare system here in the province, but hopefully there's going to be no mismanagement of funds or looting of this money, because at the end of the day it's the most vulnerable that need this healthcare and need healthcare services to operate the way they're supposed to operate. I actually asked the Premier's spokesperson whether or not he goes to any public hospital, because a lot of the time you have people saying, I'll rather die than go into a public hospital, because you either go in with one issue and you come out with 5 issues, because there's just so much pressure with doctors and nurses, understaffed, and there's just not enough, there aren't enough resources for them. So we'll just have to wait and see if the 3 billion rand is used properly.
What did he say? Does he use government hospitals?
He says he does, Sally, but I don't know if I believe that, because if he's on medical aid and he has an option, it will be interesting to see whether or not he does go to a public hospital. He says he does, but I'm not sure.
All right, thank you very much. eNCA's Heidi Giokos. Really important issues, great concerns about healthcare in the public health sector here in Gauteng.